It's the same basic approach. We've got more resources now. We're now dealing with a global phenomenon, not just a local Aotearoa one. But there's probably more similarities than differences. Not too many people die from measles in New Zealand each year, like most years no one does. Not so much in New Zealand, but globally there have been millions of people dying. What we call the Delta outbreak began in Auckland early August. All the public health units around the country have been, to a greater or lesser extent, helping Auckland cover their cases. So up until we got our first case locally 10 days ago, we were being allocated a number of cases from Auckland to follow up on their behalf. And given that the follow-up is essentially done by phone and email, whether you do it from Invercargill or Whangarei doesn't make a lot of difference. It's always good to have some local knowledge. But yeah, until we had our own cases the week before last, we were doing cases for Auckland on a daily basis. Now that we've got our own significant local workloads, we're finishing off the cases that they allocated to us up until then, but we won't be given any more until our local workload decreases. We do a recount each day at 8:30 in the morning, and at 8:30 this morning we'd had 11 new cases since 8:30 yesterday morning. All of them were in Bay of Plenty because we cover Bay of Plenty and lakes. We've had no new ones in lakes in the last 24 hours. And of the 11 in the Bay of Plenty, 10 of them are in the Western Bay of Plenty, and unfortunately one of them's in the Eastern Bay, and that's our first case of confirmed COVID-19 in the Eastern Bay of Plenty since April last year. Well, it's not so much shock because, you know, this pandemic's been around now since the beginning of last year, but it's certainly a pretty bold reminder in the last 2 weeks that we're far from through it. But we knew it was coming, so it's not a surprise. But it's interesting, some of us were saying just before that, you know, for a few months we've been handling some cases on behalf of Auckland, but somehow it feels a bit different when you know the person is just down the road and local, because we've got that local knowledge. And it does bring it home a little bit more closely when they're local people. No, we're hoping that we won't reach it. So some days in recent weeks, Auckland's been getting at or about 200 cases a day. The Auckland population's approximately 4 to 5 times ours. So that could be that we have to cope with 50 a day, you know, roughly. How would we do that? It wouldn't be straightforward, but yeah, we'll have to.